I'm Boyd Cronholm. I'm the Executive Director of the Bangor Area Homeless Shelter. My partnership with the United Way is excellent. The shelter and the United Way work well together, not just for the COVID-19 funding, but we've been a partner agency in the past. We also participate, and they have a peer-to-peer volunteer network. There's lots we participated in some training they had on how to utilize volunteers. The United Way is always looking for creative ways to help the nonprofits in the local area, and not just monetary either, just to create some networks and some systems where we all rely on each other. A lot of the grants that are out there right now are trying to expedite giving their money out. That's going to run out eventually. And so our big concern is to keep funds coming into the shelter so we can keep providing the service. The money came, and it came quickly, and it was great because it was at a time where we were hit with food. We didn't expect to be feeding this many people out our back door. We didn't expect the amount of increase in people in the community experiencing food insecurity and traffic through that. We didn't expect that I would have to have staff stay home for 6 days because they had a fever or something along those lines, so our staffing costs have gone up. Those are things we had not anticipated when this first started. And I know when this first started, United Way came out with the COVID-19 response grants almost immediately. And when I asked for it, we put in an application, and I think it was just a few days before we heard back, and we were able to get that infusion of cash to help keep us going.
My name is Captain Rebecca Kirk, and I am the Corps Officer for the Salvation Army. When we got the first grant funding from United Way, it was absolutely vital for us. Like I said, we were not equipped to be a to-go food service, and to be able to have that influx of funding that allowed us to get the supplies we needed to pretty much immediately transition our program to go. It was a absolutely life-saving line for us. We just did not know how we were going to make that happen. And so, that has been key to us being able to be so fast in our changing response to what the community needs us to do. I think that, when we look at how the Salvation Army has been able to keep up with the need, we've been able to do that because places like the United Way were there immediately to give us the resources we needed to make that transition. I think that we've been really grateful that the United Way immediately stepped up. They knew their particular influence in our community and the reach that they could have to raise money on behalf of all of the organizations. I think that, when we think of the time that we're able to invest in the work we're doing while the United Way is investing time in getting resources gathered, that's massive, right? If we're able to provide the service while funding is being gathered, that makes a huge difference for us. And I think that it's this united branding as well. We are one community working together to make this happen.
So my name is Matt Dexter. I am founder and executive director of the Christine B. Foundation, based right here in Bangor. And we are on a mission to build a community of support for those affected by cancer, not only in the Bangor region, but throughout Eastern Maine. Funding that the United Way of Eastern Maine provided us gave us the opportunity to ensure those in active cancer treatment and their household can receive proper nutrition through their cancer journey. And for us, what that looks like is we've been providing people with grocery packages following USDA My Plate recommendations with a variety of fruits, fresh vegetables, grains, proteins, a variety of other items, household items, even toilet paper if we have some available. And we also try and customize it around the very unique dietary restrictions that many cancer patients have. So we're making the dollars go a little bit further that United Way of Eastern Maine has offered us by working with some wholesale vendors to ensure nutritional shakes. We're getting other items that are very well suited for the cancer community. When you're in treatment, your diet does shift. And the purpose of this and the opportunity you all gave us is to meet that need, and that's what we're doing. I think every single part of the United Way of Eastern Maine organization we've been connecting with, whether it's through financial assistance through the responsive fund, or whether it's with looking for volunteer drivers, or whether it's with helping through the telethon and marketing and outreach. There's every single component of United Way of Eastern Maine. I think the Christine B. Foundation is working very closely with more than ever before. And it's heartwarming that an organization such as United Way is there to help nonprofits in essentially any way that they can.
My name is Sumaki Andrews, and I'm the co-chair of Helping Hands with Heart. We're really looking at a variety of issues, including substance use prevention and treatment, workforce readiness, youth aspirations. We're doing a big push on looking at how we support families who are having new babies, getting them into parent education and support, and then supporting them afterward, so a whole variety of things. But I have to tell you that COVID has really changed what we're doing. And so our work over the last several weeks has really been focused on the essential priorities, so food, fuel, and medication. And we've been able to turn every request over for people. We've not had to say no to anybody, and we have returned every request within 12 hours of their request. Sometimes it's within the same half hour. This morning I was able to get 100 gallons of fuel oil delivered to a lady up in the Moosehead Lake region who was going to run out over the weekend. And what I've appreciated in our partnership with United Way is that a couple of things. One is that they really understand that we're different and that we need to be listened to and considered differently. They honor our voice every single time they listen, and they help us. And I just have been very appreciative of their presence and their continued support. So it's made a big difference for us. I don't think we could have done it without the United Way, to be quite honest with you.